Every 40 seconds, someone in the United States suffers a heart attack, and many of these life-threatening events could have been prevented with early awareness. What if you could spot the warning signs a month before a heart attack strikes? In this video, we reveal 8 subtle signs that your body may be giving you weeks in advance, offering a crucial opportunity to take action. Understanding these early signals could make all the difference between life and death, so watch till the end to learn what to watch for before it's too late. Number 1. Persistent anxiety or sense of impending doom. A persistent sense of anxiety or a strong feeling of impending doom can be an unusual yet critical warning sign of a heart attack. This psychological symptom often arises as the body's way of signaling that something is wrong internally, even if the physical symptoms are subtle or not yet apparent. While anxiety can have many causes, unexplained and overwhelming episodes, especially if they occur alongside other cardiac symptoms, should not be ignored. This type of anxiety may feel different from regular stress or worry. It often comes on suddenly and can be accompanied by physical sensations like a racing heart, palpitations, difficulty breathing, or sweating. The anxiety may also feel irrational and unshakable, creating a sense that something bad is about to happen. This is sometimes referred to as a gut feeling or intuitive response to internal distress. The heart and brain are closely connected through the autonomic nervous system, which regulates involuntary functions like heartbeat and stress responses. When the heart struggles due to restricted blood flow or damage, the brain may interpret this as a life-threatening event, triggering the body's fight-or-flight response. This can lead to feelings of restlessness, fear, or panic without an obvious external trigger. While anxiety alone is not a definitive sign of a heart attack, it becomes concerning when it's persistent, intense, or occurs with physical symptoms like chest discomfort, shortness of breath, or fatigue. Women in particular are more likely to report psychological symptoms such as anxiety before a heart attack. If you experience a sudden and overwhelming sense of dread, especially with accompanying physical discomfort, seek medical attention immediately. Recognizing this psychological cue as a potential warning sign can lead to early diagnosis and life-saving intervention. Number 2, dizziness or lightheadedness. Dizziness or lightheadedness can be an early sign of a heart attack and should not be overlooked, especially if it occurs without a clear cause. This symptom often arises when the heart struggles to pump blood efficiently, leading to a temporary reduction in blood flow to the brain. This decrease in oxygen supply can make you feel faint, unsteady, or as though the room is spinning, and it may be accompanied by a sense of weakness or fatigue. In the weeks leading up to a heart attack, dizziness may occur sporadically, especially during moments of physical exertion, stress, or sudden movement. It can also happen when transitioning from sitting to standing, a condition known as orthostatic hypotension, which may signal underlying cardiovascular stress. Persistent or recurring lightheadedness without an obvious explanation warrants further medical evaluation. Dizziness related to heart problems is often accompanied by other signs such as chest discomfort, shortness of breath, or sweating. In some cases, it may precede more serious symptoms like fainting, syncope. These episodes can feel alarming and may lead to falls or injuries, particularly in older adults, making timely medical attention critical. Number 3, unexplained fatigue. Unexplained fatigue is one of the most common and subtle warning signs of an impending heart attack, and especially in women. This type of fatigue often feels overwhelming and disproportionate to your daily activities. It may occur even after minimal exertion or while performing tasks that you could previously handle with ease. Unlike normal tiredness, this fatigue doesn't improve with rest or sleep and can persist for weeks leading up to a heart attack. The underlying cause of this fatigue is often the heart's struggle to pump blood efficiently due to blockages or other cardiac issues. When the heart's efficiency declines, less oxygen and nutrients are delivered to muscles and tissues, causing the body to work harder just to perform basic functions. This additional effort drains your energy, leaving you feeling exhausted without any clear reason. What makes this symptom particularly concerning is how easy it is to dismiss or attribute to stress, aging, or other non-cardiac factors. However, if you experience persistent fatigue that disrupts your daily life, especially if it's accompanied by other symptoms like shortness of breath, chest discomfort, or dizziness, it's crucial to consult a healthcare provider. Early evaluation can help identify potential heart issues before they escalate into a full-blown heart attack. Before we proceed to the next early sign of a heart attack, be sure to hit the subscribe button. Number 4. Shortness of breath. Shortness of breath is a significant early warning sign of a potential heart attack and can manifest weeks before the event occurs. This symptom often arises when the heart struggles to pump blood effectively, leading to insufficient oxygen circulation in the body. Without enough oxygen, the lungs and other tissues cannot function optimally, causing you to feel breathless even during mild activities or at rest. In the context of heart problems, shortness of breath is often accompanied by other symptoms like chest discomfort, fatigue, or dizziness. It may worsen with exertion, such as climbing stairs, or even during simple tasks like walking. In some cases, people experience this symptom while lying down, a condition known as orthopnea, which can indicate fluid buildup in the lungs due to congestive heart failure. Many people mistake shortness of breath for respiratory issues like asthma or bronchitis. But when it persists or occurs alongside other signs of cardiovascular distress, it warrants immediate attention. If you notice unexplained or worsening breathlessness, especially if it disrupts your daily activities, consult a healthcare provider promptly. Early detection can prevent complications and potentially save your life. Number 5. Chest discomfort. Chest discomfort is one of the most recognizable warning signs of a heart attack, but it doesn't always present as the dramatic, crushing pain commonly portrayed in media. Instead, it can manifest as a subtle or intermittent sensation of pressure, tightness, heaviness, or mild pain in the chest area. This discomfort is often due to reduced blood flow to the heart muscle, a condition known as ischemia, which can occur weeks before a heart attack. The nature of chest discomfort can vary from person to person. Some describe it as a squeezing sensation or a feeling of fullness in the chest, while others may experience sharp or burning pain. This discomfort can come and go, lasting for a few minutes at a time, and may be triggered by physical exertion, emotional stress, or even rest. Importantly, it may also radiate to other areas such as the arms, back, neck, jaw, or shoulders, making it easy to misinterpret as a muscle strain or indigestion. Ignoring chest discomfort is dangerous, as it can progress into a full-blown heart attack if left unaddressed. If you notice persistent or recurring chest discomfort, especially if it is accompanied by symptoms like shortness of breath, sweating, or nausea, seek immediate medical evaluation. Early diagnosis and treatment can prevent further damage to the heart and reduce the risk of a life-threatening cardiac event. Number 6. Unexplained sweating. Unexplained sweating, particularly when it occurs without a clear cause such as exercise or heat, can be a subtle yet critical warning sign of an impending heart attack. This type of sweating, often referred to as diaphoresis, is typically cold and clammy and is the body's way of responding to stress caused by a lack of proper blood flow to the heart. It may appear suddenly and can occur even when you're at rest or performing minimal physical activity. The underlying cause of this symptom is the activation of the body's fight-or-flight response as the heart struggles to pump blood effectively. Reduced blood flow can lead to heightened stress on the cardiovascular system, triggering the release of stress hormones like adrenaline, which increases sweating. This can occur in conjunction with other symptoms such as dizziness, nausea, or chest discomfort, further signaling potential heart distress. Night sweats, where you wake up drenched even in a cool environment, are another form of unexplained sweating linked to cardiac problems. While sweating can be caused by various factors such as hormonal imbalances or infections, it's crucial to consider heart-related causes if this symptom persists or occurs alongside signs like fatigue or shortness of breath. If you experience unexplained sweating that feels unusual or is paired with other symptoms, seeking medical advice promptly could be life-saving. Number 7, pain in other parts of the body. Pain in areas beyond the chest, such as the arms, back, neck, jaw, or shoulders, can be an early warning sign of a heart attack. This phenomenon, known as referred pain, occurs because the heart shares nerve pathways with these regions. When the heart experiences distress due to reduced blood flow, the brain may misinterpret the signals, causing pain to appear in other areas of the body rather than in the chest. Pain in the left arm is particularly common and often starts as a dull ache that worsens over time. In some cases, the pain may radiate to both arms, though the left arm is more frequently affected due to its proximity to the heart. This pain may come and go or become more persistent as the heart's condition deteriorates. Pain in the upper back, particularly between the shoulder blades, or tightness in the neck and jaw, can also be early indicators of a heart attack. These symptoms are often mistaken for muscle strain, arthritis, or tension. However, if the pain is unusual, persistent, or accompanied by other signs such as shortness of breath or sweating, it should not be ignored. Men and women may experience this type of pain differently. Women in particular are more likely to report pain in the jaw, neck, or back during the early stages of a heart attack. If you experience unexplained or recurring pain in these areas, especially if it seems to worsen with exertion or stress, consult a healthcare provider immediately. Recognizing referred pain as a potential sign of cardiac distress can lead to early intervention and potentially save your life. Number 8, digestive issues. Digestive problems such as nausea, indigestion, stomach pain, or bloating can be early warning signs of a heart attack, especially in women. These symptoms occur because the heart, stomach, and other abdominal organs share nerve pathways, which can lead to overlapping sensations when the heart is under stress. As a result, the discomfort caused by reduced blood flow to the heart can mimic common gastrointestinal problems. Feeling queasy or experiencing persistent indigestion without an obvious cause, such as a heavy meal, may indicate that the heart is struggling. This is particularly true if the symptoms are accompanied by other signs like chest discomfort, fatigue, or shortness of breath. Many people dismiss these symptoms as minor stomach issues, but when they persist or worsen, they could be signaling an underlying cardiac problem. Some individuals report a feeling of heaviness, tightness, or pain in the upper abdomen before a heart attack. This can be mistaken for gas, ulcers, or acid reflux, delaying appropriate medical attention. Bloating and discomfort may also worsen after eating, as the digestive system requires increased blood flow during digestion, a demand that a struggling heart might not be able to meet. While occasional digestive discomfort is often harmless, persistent or recurring symptoms should raise concern, particularly if they occur alongside fatigue, sweating, or chest discomfort. If you experience unexplained digestive issues that don't improve with over-the-counter remedies or dietary adjustments, it's essential to consult a healthcare provider. Recognizing these symptoms as potential signs of heart distress can lead to early diagnosis and prevention of a heart attack. Heart attacks often provide warning signs long before they strike. Recognizing these subtle symptoms can empower you to take action and prevent a potentially fatal event. If you or someone you know experiences any combination of these symptoms, it's critical to seek medical evaluation immediately. Early detection and treatment can save lives. If you found this video helpful, please give it a thumbs up. Thank you for watching, and for more amazing videos, subscribe to our channel.